Hello, my name is Cheryl McKnight, and this is my presentation on preventing nursing burnout. This is done for Concordia University, Mequon, Wisconsin. The objectives of this presentation are as follows. 1. By the end of this presentation, the viewer should be able to define the three components of burnout. 2. By the end of this presentation, the viewer should be able to identify symptoms of burnout. And 3. By the end of this presentation, the viewer should be able to identify ways for administrative leadership to decrease the risks of the burnout. A little background information on burnout. Burnout is caused by prolonged emotional stress, prolonged relational stress, alienation. What this means to our patients is that they are more likely to be part of a medical mistake, and that they are more likely to receive substandard care. All of this always results in decreased patient safety. Healthcare professionals experience burnout frequently, and according to the article, Burnout Among Healthcare Professionals and Its Side Effects on Patient Safety, 2016, estimated for the prevalence of burnout range from 10 to 70% of nurses. When you think about a unit of, let's say like my ICU unit, there's 2 ICU nurses. And if there's 2 of us and one of us has burnout, we're already at 50%. I wouldn't want to be the patient who has a nurse who's only half there. It is believed that burnout in the nursing profession is caused by the continuous exposure to disease and illness, the continuous exposure to the pain that the patient may be suffering, a lack of self-sufficiency, a lack of authority. We are, after all, just the nurse. Also, the poor interpersonal relationship that can form with the nurse and the patients. You know the type, the demanding patient, who you can never please. But remembering that they are ill and sick should always be at the top of our list. To me, it seems like we always have too much work and too little time. You may find yourself asking, well, what exactly then is burnout? Burnout is emotional exhaustion, the ability to depersonalize a patient, and a personal low sense of accomplishment. Emotional exhaustion is when you are mentally and physically exhausted. It boils down to the inability to emotionally meet the needs of the patient or yourself. And then when you are physically exhausted on top of it, and not having enough time in between shifts to physically recover, rest, and decompression from the day before is very important. I think we've all experienced that when we've had a very rough shift and a lot has happened and you've had some acute changes, and you go home and you sit in your chair and you're like, oh my God, I don't think I can move again. And you play the day back in your head. It's that I'm so tired I can't move, and I'm so emotionally wound up I can't stop thinking feeling. To me, that's what emotional exhaustion and burnout is. The characteristic of depersonalization is that feeling of being disconnected. And it's when you're impersonal with those patients because you're just so physically exhausted. At times, it can be a hostile relationship between them or yourself. It's easy to feel like you're doing the tasks but watching from outside. Another factor of burnout for nurses is a lack of personal accomplishment. This is that feeling of, well, why did they promote her to charge nurse? I do just as good a job as she does. I'm able to balance my workload and help everyone else. I do a better job. It's that non-acknowledgement from higher ups that we all need to feel fulfilled within our work life. So what do these things mean to us as nurses? There's some significance to it. One, it leads to increased turnover rates in employees. In the article, Burnout Among Healthcare Professionals, a call to explore and address this unrecognized threat to safety, high quality care, 2017, it was stated, the cost of turnover among RNs is estimated at 1.2 to 1.3 times their salary. When you think about that number, that's a lot of money for someone to leave and to have that position refilled. I can't imagine what that must cost a healthcare provider over a year's time. How many times does a person come or a group of new nurses start, and after 6 months, they're all gone? And you think, well, that group didn't last long. You know, that's very significant when we get down to healthcare and the costs of taking care of the patient with high quality care. It is also leading to nurses leaving the profession. A lot of people are feeling that stress, and that prolonged aggravation is just not worth it. It can be very tough, and it takes a very hardy person to continue sometimes. And some nurses, they just choose to walk away. So that can be very significant. Also, as a nurse, that can cause decreased safety motivation. It's like hearing that alarm go off again. You just are so tired, and the thought of getting back up one more time to tell that person to use their call light or not crawl out of bed or bring them one more thing can be exhausting. Again, it all heads back to that feeling of burnout. Also, after a while, many nurses start to have poor attendance, and poor attendance leads to staffing shortages, and staffing shortages always leads to difficulty with having an appropriate workload. There are some factors that are very significant when it comes to the nursing profession. A risk factor is age. Younger nurses often experience burnout much more than older nurses. And of course, that leads to that emotional exhaustion we were talking about. It has been found that males do not perform as well as females and often leave because of depersonalization. Being in the field of nursing for less than 4 years leads to both emotional exhaustion and depolarization. Poor working relationships with co-workers, and leaders because of changes that are poorly communicated also add to a low sense of personal accomplishment. Shift work plays a big role. Night shift and long hours really lead to that emotional exhaustion. Other significant factors that are part of nursing burnout are the workloads. A large number of tasks to complete, whether it's discharges, admissions, labs that need to be drawn off a line, urines that need to be sent down, repositioning. While this is all going on, we also have these large patient to nurse ratios, and we just get so very physically busy that the emotional exhaustion is endless. Another thing that can lead to increased risk of burnout is your personality. If you're a sensitive person who might be a little vulnerable, you may have more trouble with dealing with some of the ethical issues that come with nursing and decisions made by families or the individual themselves that you might not agree with. Sometimes a doctor keeps a person for all the wrong reasons, and what we're doing is not helping them. Or we may be trying to do a curative action on someone who is incapable of being cured. All of this too leads to emotional exhaustion and depersonalization. The impact of these negative emotions that a nurse may feel is that it does increase healthcare associated infections. Also, it does decrease patient satisfaction scores, and we all understand how important that is with reimbursement and Joint Commission surveys. We really work very hard to keep that satisfaction of a patient up. Some of the other impacts of burnout on nurses is just that. There's a decreased satisfaction in the nursing profession as a whole. And turnover rates among nurses are high because of that poor satisfaction. And this frequently leads to job resignation. So what does this decreased satisfaction within a job have on administration? What it means is that nurses are leaving their current position and looking for other jobs and opportunities. It also means that some nurses are leaving the field altogether, only adding to the shortage of nurses we already have. So what action can administration do to prevent nurse burnout? A big one would be adjusting patient-to-nurse ratios. This can also increase job satisfaction. What these new guidelines give to nurses really shows increased quality. It can be as simple as having the time to do a thorough assessment for your patient and their condition. Also, these new staffing ratios can give adequate time for teaching, whether it's about their current condition, their plan of care, or their upcoming discharge. It offers time, and time can help build those relationships between nurse and patient, again, working for better quality and better connectedness between patient and nursing, hopefully increasing those patient satisfaction goals. Also, administration needs to assure that staff is taking those breaks. With those breaks, a nurse has a time to disconnect, clear their head, reorganize, and be more alert. And with this alertness, hopefully there will be a decreased risk of missing a change in condition. Patient safety becomes at the forefront again, and not taking a back seat to emotional exhaustion. What has been found is that employers or administrative leadership who conducts yearly surveys are more able to communicate with their staff. What has been suggested or recommended to improve this is doing these surveys more than yearly. Other recommendations that have been made for administrative leadership to help with nursing burnout is improve communication by getting to know your floor staff. Involve the nurses in the decision-making process for the feeling of professional development. Not everybody needs to climb the corporate ladder, but being part of a team and feeling part of that team is significant in the feelings of personal achievement and place within your working environment. Administration that encourages the use of purposeful rounding has also found that decreases patient safety issues, the use of the call light, and improves satisfaction scores and decreases on nursing burnouts. It's kind of like alarm fatigue. If you hear it all the time, you just become numb to it. But with that purposeful rounding, you can prevent some of these things. Also, as an administrator, always watch for those signs of burnout in your people. It may be a simple change in their behavior. A person who is usually social becoming more withdrawn, or a person who hasn't missed a day in years starts to miss days quite frequently. These are signs that you can say, is there something I can help you with? What do we need to help you succeed at your job? Also, if you do see a nurse that is having frequent attendance problems, close monitoring is very key in helping them realize that they may need to make some changes for themselves. As far as burnout goes, there's a lot of room for more research. With this more research, hopefully they can identify more of the issues for the possibility of burnout. Also, they can gain a better understanding of what causes burnout. With this understanding, hopefully there can be a development of better interventions for nurses who are suffering from burnout. With the care of the nurse who is suffering from burnout and does receive help from their administrative leaders, there will be improved health for the patients, reduced costs acquired by the healthcare facility, and increased job satisfaction for staff members with longer retention. And overall, this should add to better patient satisfaction scores. Thank you for watching my presentation. Here's a list of my resources. I hope you enjoyed the time I've shared with you. Thank you.